It is, oh, it's Thursday, the 6th. So it's actually 2 weeks ago that I had all my teeth pulled out. Um, I saw the surgeon yesterday, and they put me on Parodontax, which is a mouthwash. I go to pain management because of my MS and fibromyalgia, and I guess they were trying to get me some Tylenol with codeine for my mouth because it's hurting on top of my regular. The pain center says that my insurance won't cover it because I already take Percocet. So it just seems like everything is going wrong for me. I mean, I'll live, but it just seems like, wow, really? You get 18 teeth pulled and they don't expect you to need any extra pain medicine on top of your regular daily meds? So, yeah, I was on the phone with my pain management today. They called like 4 or 5 times. Uh, because I get a certain amount of medication every month just from my regular life. And I saw the physician's assistant at the pain management last month in June and told her, going to get 7 done 1 week, 7 taken out, and then 11 the I guess it was 2 weeks later, maybe 3 weeks, I forget. So I was supposed to see her yesterday, but they canceled it. It just crazy. Like, I mean, I said to her today, common sense. I told you I was getting all these teeth pulled. Um, Common sense says that this is going to be pain above your regular pain. They kind of pissed me off. Made a reference to drug seeking, maybe. I don't know. Not really drug seeking, but the fact that I took more medication than it says to on the bottle. And I was just like, are you kidding me? You knew that I was getting all these teeth pulled. The thing is that I see a physician's assistant. If I was actually seeing the doctor, this wouldn't have happened. But where I go, you only see the doctor when you're going to get like shots in your neck or your spine for your back kind of thing. So I only see that doctor like every 4 months when he puts some medication, epidurals into my back. But I was pretty upset this morning because, I mean, I've been going there for years. I have never, ever, ever ran out of my medicine. And it's been like 6 years, maybe 7, maybe 8. I don't even know. I don't keep track. It's been a long time. And so this one time, I call them and tell them it's gonna be cutting it really close. I'm gonna run out before the 14th is when I get my new prescription. And so what's today's the 6th? So 8 days that I may have a little problem not having any pain medicine for my regular pain. So after all these years, I think that means I took an extra pill for the last week and a half kind of thing. I mean, that's just ridiculous. That's the one thing I hate about taking pain medicine is that I always feel like you're under some kind of a microscope, and that people always assume that you're addicted to your pain medicine. And yes, you are addicted to your pain medicine because you take it every day. You're also addicted, let's say you take cholesterol medication, you're addicted to that too. But there's no stigma of the fact that you're addicted to your cholesterol medicine, your diabetes medicine, your heart medicine, anything you take every day. If you stop taking that medication, your body's going to go, hold up, what's going on here? So, yes, I am addicted to pain medication, but I'm not addicted to it in a way that a drug addict is addicted to it. I'm not going to go out uh, and look for heroin or whatever people do when they are seeking drugs. So the whole addicted thing always kind of gets to me. I do rely on them. Uh, Before I was on them, I was in a wheelchair, and now I'm not. Occasionally I'm in my wheelchair, but definitely not like I was. So to me, that when I'm on pain medicine, it has enhanced my life so that I'm not stuck in a chair. I can lead. I wouldn't call my life normal because this is where I spend a lot of my time is just sitting here on my bed or in a chair because I have to be careful what I do or else the pain gets really bad and also I'll end up sleeping a lot. So, yeah, that's what went on with me today. Pain management just made me feel really, I was just not happy. And the fact that they're saying that my insurance won't pay for the extra pain medicine. That's another thing. When you go to pain management, you sign a contract saying that you won't get pain medicine anywhere else. So every time I've had my teeth pulled, they want to give you a script. And, I always say, well, I already have a pain doctor, so I'm on pain medicine, and I refuse it. So I said that to her, the pain physician's assistant lady today. I said, that. I refused it. She's like, well, when you signed that, you assigned that contract saying that you were going to take the medicine exactly how it is on the directions, too. You signed it that you wouldn't overtake your medicine. I was like, are you kidding me? I just had 11 teeth pulled. Of course I'm going to take extra pain medicine. Well, we don't want you to overdose. Yes, overdose is always possible. But I would say that overdose is for people who are abusing their meds, okay? And for me to take one extra pill a day, I don't think that was abusing my medicine. But it's all right. That's just a little window seeing how whenever you live your life on pain medicine, you're always under their scrutiny. Even though they are a pain doctor, she's a physician's assistant. She truly doesn't understand. This woman has never had pain to know. And for her, here I am calling yesterday to say that I'm only going to make it, what's today, the 6th, 7, 8, 9. Actually, I'll have 4 days, maybe 5 days, that I won't have any extra pain medicine. So really, I didn't abuse anything. She should have been able to figure that out when I told her how many pills I had left and how many days there are until I can fill my regular meds. Anyway, it just really sucks. And today I'm watching denture videos, and I see, not everybody, but so many people, they they get their dentures, they pop them in, they're all giggly and happy, and I just want to strangle them all. I just want to go around and smack everybody. Because it is not no happy picture. It is not this easy thing. It is terribly hard. It sucks wind. It hurts. You can't eat. Now, wait until you get your dentures, and it is like having your teeth with high heels on your teeth. So your teeth are higher. It feels like you put food in your mouth, it feels like you're going to choke because you have all this stuff in your mouth already. And so any food you put in your mouth adds to all that crap in there. It is terrible. It is not an easy thing. And I just see, I got my new dentures today, and they're all, I'm ready for my close-up, Mr. DeVille. And yeah, I may be a little bit edgy, I know. But that's how I feel. I'm like, oh my god, I watched a video. I got my dentures today. And, you know, no, that's not how it was for me. And I am so sure. You see, most of the people that are making these videos, they're just like cute and happy. And they're making the video because they're just having the life, man. I mean, it's no fun. It is not going to be easy. You're going to hate them. Your family's going to be like, what the heck? Unless you got money climbing out of your butt and you're one of the lucky ones that are having these custom, wonderful denturist that actually cares about their work, it is not easy. It is not. If you somehow look at the comments on my videos, there are so many people commenting about their crappy experience with dentures and how much they hate them and how stupid they look. The one person said they look like the dentist stick dog, and I totally can relate to that. My brother, he got all his teeth pulled, and he has a beard and mustache, and he goes toothless. He has not had any teeth in his mouth for a few years now. He got his dentures. They are very, very uncomfortable. They are very hard to get used to. You cannot eat like you want. You have to learn. Now, if you are just getting top dentures, I think it's a lot easier. Because it seems like it's the bottoms that are flopping around. But for me, I've only had the tops in when I'm eating, and it seems like food is getting like stuck right at the back. Makes me feel like I'm gonna choke. You have to be so careful. Ugh, it's terrible. It is so terrible. I mean, I had no choice. Okay, I don't have money for implants. My insurance does not cover implants. But if you can afford it, your best bet would be to get like those magnets in or implant the single teeth, because then you're not going to go through this, because this is really a fun sucker. It is something that could take the joy out of your life unless you're lucky and you get somebody who really, really knows what they're doing with dentures and makes it such a wonderful fit. And I mean, my mom's had upper dentures since she was 19 or 20, and she told me right off, you're not going to like them. You're not going to like them. It's not easy. And I mean, but I had no choice. My teeth were loose. My teeth were beautiful. I mean, I had really nice teeth, you know? But I really didn't have a choice. They kept trying to save them. I kept getting infections, fillings falling out. And finally they realized that they're loose. I kept telling them how much they hurt. And, you know, they look at them, they x-ray them, they're fine. But finally, one of the dentists I saw, he was moving them. And he's like, oh, they're loose. That's what the problem is. That's why you're in so much pain. Yeah, that's what I was trying to say. But, so I didn't have a choice. And it's probably going to prolong my life some without them now, because I hopefully will not go septic as much as I do. I think that the bacteria from my teeth was adding to my liver's issues, and I was going septic about every 3 months. So only time will tell if no teeth means less septic shock and septic woo-hoo. So, anyway, maybe I shouldn't watch these denture videos because it's just upsetting me. Some of them are so beautiful. And mine aren't in here. They're in the bathroom. Mine are literally they look like some old lady's teeth, you know? I really do. And I think that when you're on Medicaid like I am, and some of the people that are commenting that the denture maker just doesn't care. And if you look at my profile, there's a picture of my denture in a plastic bag. I'll tell you how much they didn't care. When they take the dentures out of the mold, they're supposed to shave them down so that they don't look like this crazy thing, you know? And they did so little work that they took them out of the mold and they didn't even try to make them look nice. My dentist said, oh my, they didn't even take them down. No, they didn't. And then my surgeon said he had never seen dentures come into his office like that before in his whole career. So that's how much the denture maker cared, because I'm a Medicaid patient. They did a crappy job. They did as little as possible. They stuck in whatever teeth they wanted, and that's how it is. All because I'm on Medicaid. So people are like, oh, people want to live off Obamacare. They're just sucking the life out of you know what? That Medicaid, yeah, you can go to the doctors when you're sick. Yeah, you can go to the hospital when you're sick. But is it really 100% good care? No, it's not. It took me a long time to find a doctor that treated me good because I'm on Medicare. Because a lot of them figure they're barely going to get any money from my visit. I finally found one, it took a while, that actually cared and treated me like everybody else. Dentists, I went through 3 dentists. 3 dentists that, when they filled my teeth, and I found this out because the dentist that I'm at now, they drilled them out. They did not take all the decay out. They filled over decay. Why? They just didn't care. And all of those dentists knew that I have sepsis and that bacteria could have killed me. That's the thing that hurts me the most, is that they did something that was going to end up killing me in the end. And it was just found out because my new dentist ended up having to take those fillings out, and she saw what they did. And the reason why she knew that they filled the teeth right over the decay is because I saw the new dentist a month after. Not even a month after these teeth down here had been filled. I knew something was wrong. I kept going back. I kept telling them, they hurt so much. Something's wrong. They were like, nothing's wrong, they're fine. So I switched dentists. So I saw the dentist like 3 weeks after they filled these teeth. There was no way that all that decay could have happened in that little bit of time. So originally she just thought it was decay, and I said, you know what, they just filled them like 2 weeks ago, 3 weeks ago. And she was like, oh my God, they filled your teeth right over decay then. So that's the Medicaid that everybody likes to say that people want to live off of. It's not good. It's not a picnic. It's not good dental care, denture care. It's not good doctors. Some of the first doctors I went to, the offices were disgusting. There was blood on the wall, all kinds of stuff. The places were so filthy. Ugh. Why? Medicaid. Anyway, I'm sorry. I'm going to cut this because I'm just pissy. Pissy. Sorry. Hopefully one day you will see the real me again. I hope I get to see me again.